Today's discussion is about mapping your health and understanding your health history and how and when to take action. Your health is made up of many things: lifestyle, what you eat, your level of exercise, but most importantly, your family health history. Genetics play a key role in any conditions that you may currently have or develop in the future. It's important to really understand your family tree, both on your side and your parents' side, to better understand and predict disease and any future health conditions. Health conditions can be genetic, meaning they can be passed down from one family member to another. So it's important to know what health conditions and diseases are in your family history, so you can make healthy choices to help reduce your risk for getting those conditions. Knowing your family's health history can help you avoid diseases in the future and make smart lifestyle choices now. Share your family health history with your healthcare provider as soon as you have this information available. Why? So your doctor can be more aware of any health conditions that arise that may be affected by your genetic makeup, such as diabetes, heart disease, stroke, cancer, osteoporosis, and other diseases. Your doctor may also request that you have some age-related tests taken sooner as a result of your family health history. The slide shown here is a family health tree. This allows you to populate the names of your descendants, starting with your grandparents, any aunts, any uncles, your parents, and siblings, so that you can begin the process of mapping your health history. This is one example of family medical history forms that are currently available. It's a good format to follow. It's important to track the descendants, their date of birth, any serious illness or medical condition, and the age at onset. If they are deceased, list the cause and how old they were when they passed. For example, if you have a maternal grandmother that had a stroke at the age of 41 and died from that condition, make sure that that is noted here. Again, this is another pathway to help you and your medical provider better understand your health history and what you may have preconditions for. Additional information that is important to collect includes information about you pertaining to age, gender, and race. With some races, there are genetic factors that predispose them to higher instances of chronic conditions. For example, African Americans face a higher risk for high blood pressure, diabetes, and stroke, while about 1 in 3 Hispanics will suffer from high blood pressure and nearly half will battle high cholesterol. Chronic conditions are considered to be a human health condition or disease that lasts longer than 3 months. Some of these chronic conditions include arthritis, asthma, cancer, COPD, diabetes, osteoporosis, or even hepatitis C or HIV/AIDS. It's important to understand how long that you may have been presenting with certain conditions and tell your healthcare provider or your doctor so that they can help you better diagnose what may be going on within you. As we get older, age-related tests and screenings are important. These tests can help find diseases and conditions early when they are easier to treat. So talk with your doctor about which of these tests listed below are right for you and when you should have them. Again, your family health history will factor into these decisions and may prompt them to have some of these tests at a younger age rather than waiting to the set age determined below. There are many things we don't have control over, such as our age, our gender, and our race. However, there are many things that we do have control over, such as our lifestyle. Our lifestyle choices affect the instance and prevalence of disease in our body. By making healthy, smart choices, we can prolong our life and have a better quality of life. Simple choices such as healthy options and portion sizes, being physically active, getting enough sleep, eliminating tobacco, including vaping, reducing stress in our lives, and also getting regular wellness checkups help us live a long, happy life. The prevalence of risk factors is based on two categories, non-modifiable and modifiable. Non-modifiable risk factors include age, gender, and family health histories. We can't change these. Modifiable risk factors are risk factors that can even make modest improvements to affect your health in big ways. So high cholesterol, high blood pressure, physical inactivity, obesity or being overweight, smoking, diabetes, and poor diet. All of these risk factors added up can increase your chance of chronic conditions such as heart disease. So the more risk factors you have, the greater your risk for developing these chronic conditions. It's important to understand your risk and your numbers specific to these modifiable risk factors in order to determine your level of risk for chronic conditions. So you may be asking yourself, how can I prevent getting a chronic condition? Listed below, the American Heart Association has listed 7 simple keys to prevention. Number 1, eat right. When you eat right, you improve your chances for feeling good and staying healthy long term. Lose weight or maintain your weight if you are in a healthy weight range. 1/3 of our nation right now is obese, and our children are increasingly becoming overweight and obese. Get moving. Exercise. About 1 in every 3 U.S. adults report participating in no leisure time physical activity. It's important to stay active and move, not only to reduce your incidence of heart disease, but also to reduce inflammation in the body. Stop smoking or stop taking tobacco. This includes vaping. Manage your blood pressure. About 80 million U.S. adults have high blood pressure, which is about 1/3 of our population. Control your cholesterol. 40% of American adults have a total cholesterol level higher than 200 milligrams. Again, if you're not sure what your numbers are, speak with your physicians and your healthcare provider to get these checked. And finally, reduce your blood sugar levels. 21 million American adults have diagnosed diabetes. That's almost 9% of the adult population and continuing to increase. So as you consider your lifestyle habits and behaviors, these keys to prevention can put you on the right path. So how do you take all this information and turn them into action steps? Provided below is a healthy habit checklist where you can put into action specific actionable items that you can change and do every day. Keep it simple, make it easy to complete. The easier it is to complete, the more successful you'll be in the long term. So, what are the next steps? Well, let's talk about goal setting. Number 1, schedule your annual wellness checkup. I mean, let's face it, if it's been more than a year since you've been in to have a physical, it's time to get back in there. Number 2, complete your family health history. Take this information with you to your annual wellness checkup. It will be important to have a conversation with your doctor about your family's health history and any screenings that may need to be scheduled as a result. Number 3, identify your top 3 risk factors. Information from your wellness checkup will help you better identify what these risk factors are for. And when in doubt, talk with your doctor to help them identify with you. Number 4, complete your healthy habits checklist to help you reduce your top 3 risk factors. Again, when in doubt, talk with your doctor about this and see if there are simple ways and tools that they may have to assist you in reducing those risk factors. I hope you have found this information helpful and resourceful. It's important to understand your health history and how you should take action. Additional resources you can refer to are listed here from the Centers for Disease Control and Prevention, information on family health history and chronic disease, as well as My Family Health Portrait, which is a tool from the Surgeon General. They have an online health history form that you can create with your family.